Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. Last year, we published an article by Jonathan Leiter and colleagues reporting the loss of about half of the state and local public health workforce over the 5-year period 2017 through 21. Notably, departures were most likely for younger and shorter tenure workers. In the face of findings like these, the federal government created Public Health AmeriCorps, which is currently supported by a 5-year, $400 million investment, part of the American Rescue Plan Act. Now, one of the largest programs under Public Health AmeriCorps is the Minnesota Public Health Corps. What can we learn from early evaluation results of this major investment in the public health workforce? That's the topic of today's episode of A Health Podyssey. I'm here with Chelsey Kirkland, researcher at the University of Minnesota School of Public Health. Dr. Kirkland and co-authors published a paper in the June 2024 issue of Health Affairs examining early evaluation findings from the Minnesota Public Health Corps. They looked at whether the program improved the capacity of public health agencies designed to deliver services and at the career development of the program's participants. Their findings are encouraging at a time when the public health workforce has been so depleted. We'll discuss these findings in today's episode. Dr. Kirkland, welcome to the program.
Thank you. It's good to be here.
It's nice to have you as my guest, and I'm really interested in learning more about this. I think probably like many listeners, I've heard of AmeriCorps, but I have to be honest, and until I read your paper, I didn't know about Public Health AmeriCorps. Can you tell me what that is?
Absolutely. So Public Health AmeriCorps is a collaboration between AmeriCorps and the Centers for Disease Control and Prevention. It's built out of the American Rescue Plan, and it has two primary goals. The first is to increase public health capacity both immediately and in the long term, and then also help build the next generation of public health leaders who reflect the communities in which they serve. So those workers that you referenced in the introduction that have left and where the governmental public health workforce is deeply hurting, we're trying to rebuild that part of the governmental public health. And also there's a Public Health AmeriCorps is really focused on service to career pathways, which is an innovative solution to some of these workforce challenges.
I'm glad you referenced the introduction because this really is a huge problem and we really do need to solve it. And I appreciate both the urgency, but also the notion of building a workforce that reflects the community, something that public health has not always done. Let's talk about Minnesota Public Health Corps, which is a program within this. Tell me how it fits into the overall Public Health AmeriCorps program.
So Minnesota Public Health Corps is one of the largest grantees of Public Health AmeriCorps. So it is one Public Health AmeriCorps program that is situated in Minnesota. So Public Health AmeriCorps programs can be in a single state or across the nation. We are just in Minnesota. And we have two primary goals. The first is simply to increase public health capacity immediately as well as long term, and then also build the next generation of public health leaders who reflect the communities in which they serve. So really building up those younger generational workers in Minnesota in particular. Minnesota Public Health Corps in particular is a collaboration between Serve Minnesota, who is our state commission, AMPACT, who is a nonprofit that implements AmeriCorps programs across the entire state, and then, of course, where I am from, which is the University of Minnesota School of Public Health. And we, in particular, assist with the training, evaluation, and then public health content expertise. I do also want to make sure I note that this entire program uses community-engaged research tenets. So before we even began, we wanted to make sure we knew what is it that our health departments across the entire state need to know or need. And so we did formative evaluation with health department leaders across all of Minnesota, as well as we engage a steering committee that oversees the development and operation of the program. So our members are in host sites who are governmental public health. These are community boards of health. They are in local health departments, city health departments, as well as the Minnesota Department of Health as well. So they serve 11-month service terms and receive lots of coaching, training, supervision, all around support to help them be successful in their roles as members, as well as then afterwards, and encouraging them and providing them with the support they need to go into public health jobs.
So I'm really struck when we talk about public health, it covers a lot of dimensions. In the introduction, the paper I referenced was specifically about governmental, state, and local. And what I'm hearing you say is that this program is really focused on that portion of the public health workforce, those who are working at the state and local level. And you're trying to build the supply and, as you note, to reflect the needs of the communities. So, as I said earlier, I sort of heard about AmeriCorps, but I can't say I was like a real expert on that either. This is a 1-year program, and you're pulling people who have already expressed interest in AmeriCorps and saying, "Hey, do you want to go the public health track?" Is that kind of how this works?
Sort of, but not quite.
Okay.
So we do recruit specifically for public health AmeriCorps. Members who come into our program do not have to have any experience in public health. We do ask them to have an interest in public health, but that is not a requirement. And all they need, there's just a couple basic requirements, and that's being 18 years of age, legal, able to work in the United States, and be in Minnesota. So they do need to be present in Minnesota, cannot be living in another state. Outside of that, we welcome pretty much just about anyone. When they come into the program, that's when they receive the training that they need. And it really helps provide them with a basis of public health. So we do have some members who have come in with their master's in public health. We've also had members come and say, I think I might be interested in this, but I don't know. I'm not sure I want to make this my career. Let's try this for 11 months, see if I like it. Oh, hey, this is amazing. I love this. And some of them have been hired on by their host sites. Others have said, that was a great experience. I'm going to do something else. And that's okay as well.
So this really, I love that there are people with a master's, but really this program is oriented to people, as you say, they're getting a taste of something in a very intensive way, and then they can figure out whether or not this is the future for them. Let's talk about what it is you learned. You're reporting in your paper on the results from the first year of the program, and you examined the effect of the program on sort of the ability to deliver public health services, as well as on the people who enrolled in the program. Why don't we start with the capacity side? These are people being placed in, as you note, local state public health agencies that are stretched really thin, were before COVID, even more so now. And what are you learning about whether or not this meets their needs?
So we found that capacity is increased within these health departments. So in the first year, we measured capacity both pre and post. So we asked our host sites, what is your current need in 5 different categories? And then, and also what is your capacity? So need being, this is what our need is. We need significantly more help, work, etc. Just rate 1 to 10. And then capacity being how much you are able to actually implement these 5 areas. And then we did that both pre and post. And we found on average, the need decreased within each of these 5 categories and capacity increased within each of these 5 categories. So while that's very 1 year, we don't have long-term outcomes just yet, it's very promising and exciting. In this current year, so we are in our second year, we changed up our categories a little bit to be aligned with the foundational public health services model. So we are now aligned nationally, and then also within our state, we did a cost and capacity assessment. And so we have very strong baseline data around capacity in the foundational public health services model. So we are also now tracking our need and capacity within that national and statewide adopted model. And so far this year, data is looking very great and strong. So we're hoping that continues.
Well, this is very exciting because when we think about the depletion of the workforce, we think about how much talent we lost. And obviously, you can't replace that with AmeriCorps. But the notion that you can fill important needs and handle or reduce the stress on the system with people with this level of training it's a great start, even if it's not the long term and not the complete solution to the problem. Well, you also were interested in the members themselves and the experience they had and what they do with that. I'd like to know more about that part of the evaluation. We'll discuss that after we take a short break. And we're back. I'm speaking with Chelsey Kirkland about the Minnesota Public Health Corps. We've learned from just 1 year of experience that it's been of real measurable assistance to local health departments in meeting the needs of their communities. But as we noted at the outset, part of the program goal overall for AmeriCorps and Public Health AmeriCorps, and specifically in Minnesota, is to increase the size of the workforce and particularly draw people from the communities that are served by these programs. So with that in mind, maybe you could tell us a little bit about the experience the Corps members themselves are having and what they report from your evaluation.
Absolutely. So overall, all of our members were very highly satisfied with the program. While satisfaction is not everything, it is really important because, I like to say that positivity breeds positivity. And so if they have a wonderful and successful program and experience, then more members are more likely to come in and we can continue this great work that we have been doing. We also did find that the members themselves really felt that they had a positive impact on their community and they learned a lot throughout the entire program. So we measured their skills pre and post, and all of their skills significantly increased, as well as their intent to go into public health, be that further education or going into an actual job. And as I mentioned earlier, we actually had several members get hired on by their host sites. So I know, Alan, you said that we may have lost a lot of talent, and not all that talent can be replaced by Public Health AmeriCorps. However, at the same time, we are still able to replace some of that talent. Whether or not that is we sparked an interest in someone, so they go on to get further education, and now that person has that talent that was lost, or some of these positions may not need high technical education, and that person can be trained into that position. That's not the case for all, but there are definitely some positions in which that can be the case.
Yeah, I mean, it's just sort of an exciting story. You bring people in, some of them work out, and some of them say, this is what I want to do, and they're helping at the beginning, but they can offer even more as their skill set increases. You did mention the goal of representing the community served. Is there anything you can tell me about the demographic characteristics of the Public Health Corps members?
When we compare our Public Health AmeriCorps members to the current existing Minnesota public health workforce, only about 1% of the current Minnesota public health workforce is under the age 24, whereas I believe it was over 67% was under age 24. So we're really able to help fill or potentially fill a huge workforce gap in there. And then even when you move to the next age bracket of 25 to 37, still a significant, very few workers in Minnesota who fit in that age bracket, and significantly more who are Public Health AmeriCorps members. And when we look at racial diversity, still majority white, but there's a much larger portion who are non-white in Minnesota Public Health Corps than the current existing Minnesota workforce. Still, we don't have long-term outcomes on how many of these workers will go into the workforce, but building a stronger supply creates a better pathway and more likely to get some of those younger and diverse workers into the current workforce.
And I wonder if you could relate that. We spoke earlier about the capacity and needs of the host sites, but one of those goals that they have is to engage with their communities. And it does seem that bringing in community members, people active in the community, ought to help them with that engagement. So you gave sort of a general answer that did improve the ability of these sites to meet the needs. But were any of those specific to community engagement? Did you see improvement there?
We found that about 80% of the host sites indicated that core members helped them reach new communities, and about 55% of them stated that members helped them increase the number of services provided, and which is really important. And actually, when we've spoken with some of these host sites, one even shared that there are some communities and some programs that they had not been able to implement. And if they did not have Public Health Corps, they would not have been able to implement those programs. Sometimes sites have referred to as bringing those back burner projects back to a front burner, and really able to address that. And then also, as you also mentioned, Alan, of bringing in community members. One of the biggest characteristics that host sites ask for in hosting a member is that that member is from the community. And so not only is that meaning that governmental public health wants to get back out into the community, increase those connections, and make a difference, it also means that these members are able to help those health departments do those goals and make those connections.
Well, when I read the paper and listen to you, I have to say I come away with a quite positive feeling about the program. I acknowledge that this is just 1 year in, and there, of course, more we'll learn over time. But given that whenever you start doing something, you kind of have to learn as you go, it seems important to look back, even if it's just a year on the program, and see how it's doing. I wonder, given that this is a national program, based on what you've experienced in Minnesota and what you've learned, whether there's anything you would say either to other sites or to federal policymakers as they think about those 5 years will be up one of these days, and as they start thinking about whether this is a program that should remain.
Sure. So let me start by speaking to policymakers. Yes, we have preliminary data, and our data is very promising. And it takes time to know the true ultimate effects. But these preliminary data show that programs like this can be very effective. No one wants to see a pandemic like we just experienced. And one of the best ways to prevent that is by building up our governmental public health workforce. Second, I'll speak to other programs, both large and small. Health departments. I've talked to some different sites or different programs across the nation, and they want to work with health departments. That sounds like a great idea. And they struggle. And first, I'll share, we had some challenges at first as well. And our big key was working with public health consultants. These were well-known, well-trusted individuals, just like when you're working with community members. You need to find the people who can help you get in the door. Health departments are the exact same way. And they want to connect. They want partnerships. And so knowing that they want that and they want to engage is really important, but then finding the people who can help you make those connections can be equally important. And thirdly, one of the biggest things that I like to talk about is the data. And data is really important. It can feel very nebulous, very overwhelming, especially for smaller programs. And the biggest piece of advice I and my team often give around this is do something. If that means old-fashioned paper and pencil survey, but you can show that you had something, you made a difference, great. And then shout it from the rooftops. Sometimes I know some program leaders are wearing multiple different hats. Just putting in that data hat at least once in a while can make a really big difference. And then also just really looking at what are you doing? Start with the end in mind and work backwards. What is it that you want to do? How are you going to get there? And what is the data that you need to collect and the data that you can collect?
Well, those all sound like really useful points. And the notion of people wanting partnerships but being too busy really rings true throughout healthcare. People always say we should do team, we should do partner, but everyone's got their head down trying to get their work done. And so figuring out the resources necessary, the mechanisms necessary to build those partnerships that then can do things that wouldn't have been possible otherwise seems like a really excellent starting point. Well, Dr. Kirkland, it's great to hear about the program and the early results, the promising results, and to just see the enthusiasm of trying to tackle a very real problem that we have with real consequences for population health and public health, and to just learn about how one state has taken this challenge seriously and implemented a program designed to overcome some of the barriers. And as you noted, with designing the program with what you're trying to accomplish in mind, it sounds exactly like that's what's happened. So I appreciate the work you're doing, the paper that you and your colleagues wrote. Thank you for being my guest today on A Health Podyssey.
Thank you for having me today.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about A Health Podyssey.